What causes non-healing sores to itch and hurt at night? Imagine a sore that just won't heal, and every night it seems to become more uncomfortable, itching and hurting more when you're trying to rest. Non-healing sores that itch and hurt at night can be caused by a variety of factors related to the wound itself, the skin's condition, nerve activity, and your body's natural rhythms. These sores are wounds that do not follow the usual healing process within a typical time frame. Instead, they often stay inflamed, have dead tissue, or become infected, which can make them itchy and painful. At night, these symptoms might feel worse because of how our bodies and environment change during sleep. One major reason is the environment of the wound. Chronic sores often have dry skin, dead tissue, bacteria, and ongoing inflammation. These elements can irritate nerve endings in the skin and surrounding tissues, leading to sensations of itching and pain. If there is fluid leaking from the sore or swelling around it, these can also increase discomfort and the urge to scratch. Sometimes, the presence of new blood vessels or granulation tissue in the wound can add to the sensation of itchiness and pain, especially when the wound is not healing properly. Nerve involvement is another key factor. Damage to nerves near or within the wound can cause neuropathic itch and pain. This type of nerve pain isn't just from skin irritation but from nerve dysfunction itself. It can produce burning, tingling, or even electric shock-like sensations along with itching. These nerve symptoms tend to worsen at night because the nervous system's sensitivity can increase when distractions are fewer, and the body's natural circadian rhythms shift. Underlying skin conditions such as eczema, psoriasis, or neurodermatitis can also play a role. These conditions cause persistent itching and discomfort that can make wounds worse or delay healing. For example, scratching or irritation from tight clothing or insect bites can worsen the sore and make it more likely to stay open and symptomatic. The itch-scratch cycle common in some skin conditions can lead to sores that do not heal properly, especially if scratching causes additional tissue damage. The body's natural circadian rhythm influences many skin functions. During sleep, skin temperature drops, moisture levels change, and nerve sensitivity can increase. These physiological shifts can make itching and pain more noticeable at night, turning a mild discomfort into a more intense sensation. Reduced external stimuli also mean you might notice the symptoms more when lying still in the dark. Infections in the sore can cause increased inflammation, which heightens nerve sensitivity. This inflammation can make the sore more painful and itchy, and if left untreated, it can prevent the wound from healing. Persistent inflammation also keeps the wound open and symptomatic, making symptoms worse at night. Psychological factors like stress and anxiety can amplify the perception of itch and pain. When you're stressed or anxious, your body's response can worsen skin conditions and interfere with healing. This can lead to more intense symptoms during the night when mental distractions are fewer. In the context of skin cancer and healthy skin, it's important to recognize that some non-healing sores that itch and hurt could be signs of a more serious problem, such as a malignant lesion or precancerous change. If a sore persists, causes discomfort, or worsens over time, it is essential to seek medical evaluation. A healthcare professional can assess whether the sore is benign or requires further investigation, including biopsy or other tests. If you notice a non-healing sore that itches and hurts, especially if it persists for more than a few weeks or changes in appearance, it is crucial to see a healthcare provider promptly. Avoid scratching, as this can worsen the tissue damage and increase the risk of infection. Keeping the skin moisturized and managing underlying skin conditions can help reduce itching. If nerve involvement is suspected, medical treatments may help relieving neuropathic pain and itch. Overall, the reasons why non-healing sores itch and hurt at night involve a complex mix of wound environment, nerve activity, skin health, and body rhythms. Proper diagnosis and management by healthcare professionals are key to addressing the underlying causes and promoting healing while easing your discomfort. Remember, every case is unique, so personalized medical advice is always the best course of action.